Hi friends, this is Dr. David Russ. I'm a chiropractor, mostly focusing on myofascial work here in beautiful Portland, Oregon. Today I want to talk to you about releasing tension from your knee, particularly that area of the knee that I call the deep distal quad. Deep meaning closest to the bone, distal meaning closer to the knee, farther from the hip, and quad because it's the quadriceps. I have found that in most cases of chronic knee pain, there is at least some measure of tension and restriction in the deep distal quad, the muscle, and the connective tissue. It's really not that hard to release on your own. It's an area that most of us can reach with our own hands, so let's see how to do this. This is the area of my deep distal quad from the kneecap about, half, third of the way up toward the hip. And we're going to remember that the quadricep is not just the front of the thigh, it's the sides too, and even somewhat wrapping around the back. The quadriceps does attach to the back of the femur, and it's important to remember that. That's a thing that a lot of people forget. So we start with gentle skin level stimulation. It's easy to forget how much movement there is in the skin. You can see as I grab my skin and move it, how mobile it is, and it has to be mobile. We need differential movement between the layers of our tissue in order to have any flexibility at all. If you don't believe me, ask a tree. Trees are flexible, but they're different layers of tissue, the bark and the wood underneath. They don't move in relation to each other. So the tree can bend a little bit, but it can't really flex that much. If you happen to have a massage gun, this is a really good time to break it out. This is mine. It's the Bob & Brad T2 Pro Massager. I like it. It's light. It fits in my hand really nicely. It's USB-C charging, so it's fast charging, and it's got a really good battery. I'm going to be using it with the warming head today. This thing is pretty cool. This massage head also is USB-C charged, and it warms up really quickly. So I'm going to spend just a couple minutes on low speed and using some heat to get a little bit of movement and circulation, and the heat is pretty relaxing into my deep distal quad. And you can see I'm not using a ton of pressure really. I'm not pressing at all. Pretty much just the weight of the massager is enough. And moving it about 2 inches per second in linear or sometimes little circular movements. And I'm just letting it do the work for me. Being careful around the bony prominence of my kneecap because the massage gun will just bounce on a bony prominence. It's not harmful, it just doesn't really feel very good, and it's not very therapeutic. Remembering to get behind the IT band because, believe it or not, this is still quadriceps here. Vastus lateralis wraps all the way around. Got some oil on my hands now, and now the gliding is a little different than the skin moving we were doing before. So here, the oil lets my thumbs glide over the skin. So the skin still does move a little bit, but now I'm more able to move and access the fascia underneath the skin. Using my thumbs, the heel of my hand. We don't need to go too fast, and we definitely don't need to go too deep. There's really not much benefit to causing pain in yourself with this. We're not doing trigger point work right here. What we're doing is mobilizing fascia. So just doing some gentle strokes, thumb over thumb. And then let's take the heel of our hands and stroke upward like this. You're following along. You can do whatever feels good for you, definitely honoring your choices and what your nervous system is telling you feels good. What we're going for is a sense of warmth and relaxation and mobility. Spreading that oil around. Don't forget the back of the thigh as well. And now we're starting to get ready to release a little bit more. Now using 1 or 2 fingers on either side of the meat of the quadriceps, I want to think about getting my finger between the muscle and the bone. So I can feel the very, very, very firm bone in the very center of the thigh. And this is a very gentle, very simple myofascial release technique, pinch and lift. So it's like I'm getting my fingers on the bone, bringing them toward each other, trying to sort of insinuate them underneath the muscle, and then pulling up toward the ceiling. And you can see the tissue lifting. Oh, you can see, I don't know if the camera really caught the little bit of twitching that we just saw on my deep distal quad right here, but that's a nice sign of neurological changes, as nerve energy that is stuck in the tissues starts to dissipate and discharge. It'll sometimes result in just a few seconds of twitching, which is different from the leg shaking that some people experience and report coming along with fatigue of the legs or a lot of dissipation and discharge of tension in the legs. They get almost like the whole lower body shaking. What we're talking about here is just a little gentle twitch. So trying to get underneath that muscle and lifting it toward the ceiling. Underneath the muscle and lifting it toward the ceiling. And giving yourself a break every few moments to give some gentle skin level stimulation. So I do this to patients all the time. Distal quad, pinch and lift. Here's a little bit of a different angle on that. So you can see both my hands. My thumbs are here, they're not really doing much. It's really very much the fingers coming on each side of the bone, pressing into the bone and then coming up to the top of the bone. Now here I'm between the quadriceps and the bone. It's slightly achy under there, and I'm lifting it to the ceiling. Lifting it to the ceiling. So here's my deep distal thigh, and the first thing we're going to do is give it a full contraction by lifting the foot off the floor and then squeezing, so it's like you're pulling the kneecap toward the hip, and then relax. Give it a squeeze, and then relax. Squeeze, relax. One more time. Squeeze, relax. Now what I want you to try to do is pull that kneecap up toward the hip without lifting the foot. So you're able to get a little contraction of the quadriceps without really any movement of the leg. Relax, contract, relax. Good. We're going to slow this down now. This is the part where we really feel and we take our time to sense these tissues right here, what they feel like when they're contracted. And then we're going to relax it really slowly so we get some practice relaxing that muscle. And we teach our nervous system, contract, hold, relax. Teach our nervous system, what does it feel like when these tissues are open, relaxed, and passive. Do it again. Contract. You can see there's no movement in my leg. And relax all the way. Take a moment to mobilize that skin and fascia. Give it another gentle little pinch and lift. Pinch and lift. Pinch and lift. For whatever reason just now, I was kind of inspired to use the heels of my hand, wanting a little stronger but also broader pressure. Let's turn the hip, right? So we're turning the knee in, and we're going to do the same thing, lifting the kneecap. This is really focusing on the vastus lateralis here, and then relaxing. Contract, release. It's hard sometimes for us to wrap our brain around the idea, contract and release, that the point of the exercise is not the contraction, but the relaxation phase, and to let that relaxation phase happen all the way. Take a pause before you contract again, and really close your eyes if you need to, but focus on the sensations that you get as that muscle relaxes, as it goes completely into its relaxation phase and becomes totally quiet, or quiescent, as biomechanical people like to say. Biomechanists, relax. Another moment of myofascial work. There's a lot of neurological activity happening in this leg right now. It feels really warm. I'm getting a lot of sensation from there. We're going to work now on the vastus medialis, which is this inner part of the thigh. Now, it's most active in just the last 15 degrees or so of straightening the knee. So we really want our knee to be pretty straight. You may need to scoot forward on your chair, get the heel on the floor, and just allow this knee to kind of hang in full extension, so that when you go to lift that kneecap, the vastus medialis engages. There it is right there. And then the relaxation phase happens slowly and controlled, and I let it relax all the way. So right here between my fingers. So here we go again. Lifting the kneecap, sensing the medial thigh tightening. Now I feel the tautening. That vastus medialis comes all the way up. And don't forget, it attaches to the back of the femur as well. And then it relaxes. Whew. Full relaxation. Lift that kneecap. Keep that hip nicely externally rotated. Check in with your pelvic floor. It's okay if it's a little active, but we don't want it gripped. And then the relaxation phase all the way. Thinking of my whole muscle here just being like jello. 2 more. Lift the kneecap. Boom. Ooh, I feel like I got a really nice full sensation of engagement of my medial quad here. And then we're going to relax it slowly. You can see that my nervous system sort of struggles to relax it slowly, in that it's kind of an all or nothing thing. So that's part of my practice here today. I get a nice full engagement. Can I relax it slowly? This time it's a little better. Yeah, I was able to do it incrementally. I know I had said 2 more 2 ago, but that one felt good, so I want to do 1 more. And of course, you are welcome to do as many as you like. Contract. Relax slowly, incrementally. Good. And 1 more time, some gentle mobilization. Skin, fascia, pinch and lift, pinch and lift, pinch and lift. Hopefully your knee feels a lot more relaxed and open now. I hope you come back and revisit this video again, and we'll post some more self-care for the knee soon. This has been Dr. Russ from Portland. Hope you're having a great day. Bye-bye.